Namaskar, I am Dr. Charulata, Chairperson of the Breast and Puerperal Health Committee of Fogsi, and I welcome you all to the 207th episode of Gyan Pravah. Gyan Pravah is a podcast series started by our very own beloved Dr. Sunita Tandulwadkar, President Fogsi 2025. Madam's energy, Madam's enthusiasm has made sure that this year is filled with the most amazing projects, whether it is Sampurna, whether it is Do Tike Zindagi Ke, whether it is Nirmal Ganga, or whether it's the Swasth Nari Abhiyan Yatra, she has done it all. Madam, we are in awe of your energy and we would like to request you to speak a bit about Gyan Pravaha.
Thank you. Thank you, Charu. And welcome, Parag. Welcome on a Foxy platform. With Parag, I developed such a close relationship over last 2 years since I have taken over the Foxy presidency. Since the gadget has come, last 2 years we are working so hard. And Parag, you are an asset to your organization. You should know about it. Charu, this is one of the best. We have crossed 200 podcast series is such a fantastic. When we started, I had the purpose just to give a special platform to all my chairpersons where they get their own time to show their creativity, talent, their oratory skill, and they can interview the faculty of any level. So that is the leadership quality one has to build if we want to progress in our organization. But believe me, Parag, I am more enriched with the knowledge, with the people with whom I meet in every podcast. And I feel we are very small. We work only in a small platform. There is so much in a life to do. And so many people are doing such an amazing work. It's an eye opener to meeting those personalities every day, even for 2 minutes, but I meet everyone. Initially, Ashwini, Charu, everyone was saying, make it 365 days, 8 p.m. to connect. It's too much of a responsibility you are taking over. But I felt it's okay. Life is full of challenges. Let's take this challenge. And believe me, this Gyan Pravah podcast series is one of the best program of my year. With all my chairpersons, their enthusiasm, their passion, their hard work is obviously palpable. So before selecting the faculty and after selecting the faculty, I'm sure they are doing a lot of homework so that their podcast become one of the best. Charu has always come out with the best podcast. And I wish you all the best and enjoy the dialogue. Charu, me and Parag, we have traveled together. We had such a great dialogue. We know each other so well. So I'm sure probably you don't know Parag so much. I know. And with this podcast, probably you will know more and you will bring out the different personalities of the organization. Thank you. Thank you, Parag, and welcome on this Foxy platform.
Thank you so much. Thank you so much for those words, madam. And indeed, it is a pleasure to invite Dr. Parag Bhamre on today's platform of Gyan Pravaha. Madam, I know Parag since 2017 or 2018. So that is quite a long time. And that time he was associated with the Manyata initiative. And my hospital was one of the first ones to do it in the city of Pune. And the way he has blossomed over the last 7-8 years is indeed simply amazing. And that is exactly why today he is a special person today on our podcast. And we are calling this podcast Beat Breast Cancer, the JHPIEGO initiative. Genuinely, Parag.
Fantastic.
Yeah.
Fantastic. What I mean is we are not here to this thing who knows Parag more. What I mean is the way we have created our projects, the way we work together with each other, the discipline of mine I saw. Parag goes, come to Delhi, Aero City, 3 p.m. sharp. He will be there. Travel with me to Agra, he will be there. I have a lot of things to discuss. I don't have a time to sit across the table. We discuss on the way to Agra, we utilize that time. He never used no word. And that is what the commitment of it is.
Right.
Thank you, Parag.
Right. So Parag has given a very short biodata of himself, although he is worth so much more, as Dr. Tandulwadkar ma'am was mentioning. Parag is a medical graduate and a public health professional with specialization in health policy, economics, and finance. Such a variety of things. His experience spans from local NGOs like the Janaswasthya Sahyog to global health organizations such as the WHO, Vadhwani AI, and of course, JHPIEGO. He has contributed immensely to transformative health initiatives. Parag has a strong focus on women's health, particularly in the area of women's cancers. He has been instrumental in implementing evidence based strategies for early detection, care navigation, and the decentralization of diagnosis and treatment services. His work has included the design and scaling of programs that incorporate cutting edge innovations, including technology powered solutions to improve access and quality of services, especially in underserved areas. Currently, Parag serves as the global technical lead for women's cancer with JHPIEGO. I think only a person of Dr.
Charu, uh,
can
one more
recognize.
introduction you have not added. He has started, it's not Nirmal Ganga, it is a Nirmal Banaras Abhiyan. And Parag has worked with me for getting the finances, implementation of plan, and everything.
Fantastic. So only a person of Madam's caliber can really, bring out the best in a person like Dr. Parag Bhamre. And so we are really indebted to you, Madam, for, making sure that Dr. Parag is doing such amazing work in association with Foxy and other organizations that today he is a wonderful guest on our Gyan Pravah podcast series.
Parag, after this, just give me a call in the evening. I need to talk to you about our project. Thank you. Bye-bye.
Thank you for your presence. Thank you. Bye-bye. Thank you. So, Dr. Parag, we all pass out from our medical colleges. We get our degree, and everybody dreams of, either super specialization or starting a practice somewhere, or, having a hospital, and, you earn your livelihood, you make a name. And what made you, move into this very, very parallel branch of NGOs and working with various organizations? It is a path less trodden by the medical community. So what drove you over there, Parag?
No, ma'am, thank you so much for that question. And first of all, ma'am, thank you so much to you and Dr. Sunita, ma'am, for those for those very, very kind words. I'm really humbled and honored to be on this platform. And it is like, it's great to see that 200 plus specialists have spoken on this platform, and this continues. And this energy and zeal is very much visible in this entire thing. So, ma'am, to answer your question briefly, I studied at Opiola National Medical College and Nair Hospital, Mumbai. As you know, we have preventive and social medicine in our second MBBS. When I got exposure to it, obviously there are various reactions that come to preventive and social medicine because of.
Yeah, it is an option most of the time.
That is not the chosen one by many. But ma'am, incidentally, what happened, I got to travel to Matheran. Many of us know about Matheran. It's a hill station nearest to Mumbai, just 2.5 hours from Mumbai. But interestingly, when I went to Matheran with one of the local NGO, rather than going to the hill station, I got to travel to the other side of Matheran, where there is one small NGO which was working on rainwater harvesting. When I was visiting and seeing that NGO, the situation on the field during those early years of my career really, still haunts me, I must say, because I even now see that sort of a situation in other parts of the country. And that was the moment when I really decided that I probably will not be able to, practice the way usually a clinician or a doctor practices. And decided to pursue my career completely on the community medicine side or the public health side. Thankfully, I got mentors and professors and guides within medical college and also outside the medical college who helped me to choose right branches. And after my MBBS, I decided to join Tata Institute of Social Sciences because it's again, it is not a typical preventive or social medicine type of academics. It's more on social sciences side. And there again, because of the blessings and guidance of faculty at the institution, I could learn about the applied public health. And that applied public health was around health policy, was around financing that is required, was around different approaches that need to have better solutions of our problems which have not been solved for years or decades. And ma'am, all the major credit of all these choices, I'll give it to right mentors and guides that I got in the process. So whenever I had those sort of questions, they really helped me. And
Yes.
instead of going for competitive exams, I decided to pursue the other path.
Wow, wow. Really, really creditable, Parag, because most of us just tend to want to pass in the subject of PSM, and as you rightly said that Mathiran is more for trekking and sightseeing, but you found your calling over there, and that is so very important. You took it up with so much of passion and zeal, and I think that likes attract likes, and so maybe your mentors saw the spark in you, the passion in you, your dedication towards healthcare, and that is exactly why the whole thing really worked out, and you progressed so fantastically from local route NGOs right up to WHO and of course JHPIEGO. So can you tell us a little bit about JHPIEGO? When I first heard about JHPIEGO, I couldn't even spell it I mean, you say it properly. And then when you realize what JHPIEGO is, your eyes just brighten up. So we would really like to hear a little bit about JHPIEGO and how JHPIEGO happened with you, Parag.
Sure, ma'am. So, ma'am, JHPIEGO is a Johns Hopkins program for international education in gynecology and obstetrics. So
Okay.
it used to be the short form. The name JHPIEGO is complex, but it used to be a short form of this long form that I just mentioned. It
Right.
started by the OBGYN department of Johns Hopkins University around 52 years ago. And it started as an effort of those faculty at the institution or at the university to bring evidence-based practices to Asian and African countries. So it
Okay.
started like an outreach activity of the department.
Okay.
So last GO in JHPIEGO is actually gynecology and obstetrics, and that's why
Okay.
we believe that Fogsi is our very close collaborator in anything that we do in women's health. But now over the time, ma'am, JHPIEGO became our name. We no more use it as a full form, and we no more even have limited ourselves to only gynecology and obstetrics. There are various fields in which JHPIEGO works. The latest pandemic response or the COVID-19 response is something which is crucial to mention because JHPIEGO was supporting quite a few state governments
Right.
in implementing COVID-19 vaccination as well as establishment of care centers across all the levels. Today, there are around 11 to 12 different thematic areas in which we work, starting with family planning, maternal health, women's cancers, digital health, pandemic response, health system readiness, and so on and so forth. And we believe that we are pretty hungry when it comes to areas and domains because we just wait for right opportunities to get into those areas, build our muscles, and then continue to contribute as technical assistance partners.
Wow.
And ma'am, I also want to mention JHPIEGO doesn't do parallel programming. We always do it with collaborators. We always
Okay.
do it with partners. We
Okay.
don't have our team implementing things. We usually facilitate, bring those latest evidences in right forms and shape, and provide those templates, tools to our partners, so that they can leverage, use it during their service delivery. And ma'am, I know with you, I had a wonderful experience back in 2017-18 when we together worked on Manyata initiative.
Right. Right.
And yours is one of the initial centers which actually got accredited under Manyata.
So true.
That is also one example how
Exactly.
we continue to
So
work.
many things, really, so many things being done via JHPIEGO. And I think this is so very important that, the local organizations know the pulse of their community. They know what exactly they want. And so when you collaborate, I think, it has a multiplied effect, with your, what do you say, positivity and maybe the funding and the vision and the know-how from the local organization. These two things together come out and give a wonderful output, which is what is being done by you people, and that is really amazing. And yes, as I was telling Tandulwadkar madam that we know each other now since such a long time, and I think the Manyata program which you launched, or which you conducted for all the private practitioners, because we know that the government does a lot, or most of the government hospitals have a set protocol for many things. Their staff are trained accordingly, but private nursing homes do not have so much of trained staff. Most of the time they are unable to afford them, or the trained GNMs, ANMs do not wish to work in smaller hospitals. But most of our deliveries and most of our gynec care is taken place in the smaller hospitals. And to improve the health of these smaller hospitals, what JHPIEGO did through Manyata was really fantastic, and we really owe a lot to you, with Dr. Hema Divakar, Madam, Dr. Rishikesh Pai, and of course you, Parag. We are really thankful for the entire change that has come across through so many states and through so many nursing homes, private nursing homes, that today we can really boast of having very minimal morbidity and almost no mortality at all. So thank you once again for that, Parag. And so when, going through this maternal health care and, other initiatives of vaccination, was there any turning point as to how did you enter into the field of cancers, cancer prevention, or early diagnosis of cancer? Cancer can be quite a morbid field to enter, and some people may want to shy away from these kind of morbid places. On the other hand, maternal and child health is so much more positive, with giving positive results. So how did you turn to cancers, Parag?
Yeah, ma'am, very, very valid question. So as you know, over last 2 decades, and if I talk only about India, over last 2 decades, we have seen a considerable progress in improving maternal health.
Right.
We have seen significant reduction in maternal mortality. And as I mentioned, JHPIEGO, it's in our DNA. We try to address problems which are really grave, really hairy, which are very difficult to solve. And we believe that over last couple of decades, all the significant progress in maternal health, demands our attention to areas where we are probably dying more and more women or family members for different reasons, right? And when this sort of an exercise was happening, right around 2017-18, we decided to pursue in India programming around cancers.
Right.
And in JHPIEGO, we have been working in cancers for around 2-3 decades. In fact, the approach of screen and treat for cervical cancer,
right,
JHPIEGO has been lead implementation partner across other countries. But my exposure to cancer programming started around 2017-18, ma'am. And main reason, if I put it in perspective and give some quote some numbers here, and maybe I can use a slide for that.
Okay.
Just to emphasize on those essential components. If you can see my slide, ma'am.
Yes, it's visible.
Okay. So if we just map the preventable deaths amongst women in India, UNICEF estimates that around 30,000 women die even today annually because of causes of maternal mortality. But if you look at the other cancers, Globocan estimates, and I'm using 2020 estimates in the infographic, but I do have latest estimates in which numbers are even higher. But Globocan estimates that around 60,000 plus women die because of cervical cancers annually in India, and 90,000 plus die because of breast cancers annually in India. So even if you look at the burden of these two cancers, amongst women in India, that shows why we need to really do something in these two cancer areas, right? Now, along with this, there are also global initiatives which are giving you frameworks, like if this is the problem, there are frameworks, there are initiatives which are guiding possibly country programming, right? And on the right side of the slide, if you see, there is a global breast cancer initiative, which is giving a target of 60-60-80. It says that if you really want to save, let's say, these many deaths for the case of breast cancer, you have to ensure that 60% of the cancers are diagnosed in early stages. And hence countries have to do health promotion, early detection for that reason. If you want to really diagnose in time, it should happen in 60 days. And if we want to ensure that, those patients who are diagnosed are saved, then we have to ensure that 80% of them are put on treatment as appropriate. So when you have problem identified and when you have targets well defined at global level, at JHPIEGO, what we decided is to pursue and bring these experiences or bring these particular evidences right on the ground, and our attempt was to deploy these initiatives, deploy these targets, deploy these frameworks right in our country.
Right.
and thankfully being in Maharashtra, that time I was working out of Mumbai. We all know that many of our patients come to Mumbai for cancer care. I
Yes.
got the opportunity to then work on this particular, entire idea that JHPIEGO was nurturing at that point in time.
Absolutely fantastic. Because what happens now, we still believe that it is the maternal morbidity and mortality which is the major killer. And this slide was such an eye opener where we realized that, oh my God, cervical and breast cancer are even bigger killers and bigger the problems of modern India, and that they need to be targeted, they need to be looked into. And that is why, when the Breast and Peripheral Health Committee of Fogsi, which I lead, we realized that although the gynecologist is the first point of contact for most women, and unfortunately the breast as an organ has been, kind of taken away by the surgeon, and we no longer look into any breast issues because every gynecologist, just sees some breast problem, will always refer it to the surgeon, without realizing that if he or she would delve a little into it, read a bit about it, and manage these cases at their level, probably there could be an early diagnosis of breast cancer. And that is probably a big problem in India, that the mortality associated with breast cancer in India is far more than what it is in the West. Although our numbers may be less, but lesser than the West, our mortality is significantly higher. And so I think that this initiative taken up by JHPIEGO for breast cancer awareness and for early diagnosis of breast cancer is probably a great thing that has been done. And we really appreciate you for this. And so we really want to know a little more about what exactly is this project that you've taken up. How have you started it? How are you going ahead with it? Is it going to be a countrywide initiative? We are really very keen to know, because all of us are really wanting to join hands to bring about early diagnosis of breast cancer. We know that no cancer can be really prevented 100%, although yes, so many things like breastfeeding and what do you say, preventing taking some specific kinds of hormone replacement therapies can decrease the incidence of breast cancer. But we know that if we have an early diagnosis, that is going to go a really long way in bringing down the mortality because of this disease. So over to you, Parag, for your fantastic initiative. And we really want to know as to what you are doing for this.
Sure, ma'am, sure. And ma'am, very well said, regarding possible role that gynecologists can play in this entire work. And I strongly believe that they definitely can do much more than what they are right now doing in breast health, with all due respect of all the great efforts. And I'm so thankful to you and your committee members, for taking some very proactive role in making this a reality across the country with different abhiyans and missions that you have been running. So to answer your question, ma'am, when we were conceptualizing this particular initiative back in 2018, we initiated it in Uttar Pradesh and Jharkhand. Uttar Pradesh being the most populous state and Jharkhand being one of the tribal states in the country. And the third state that was chosen was Maharashtra, because of the natural reasons that many patients do come to Maharashtra and there are well-established setups in Maharashtra.
Right.
But the approaches that we used were two-pronged. In Maharashtra, we were essentially working at the facility level, because you have setups here. So
Yes.
how do we, really make existing setups better? How do we have in-facility care navigation? And how do we really decentralize diagnostics and therapy within those existing setups? So that was the arm that we were working on in Maharashtra. In UP and Jharkhand, we were working on the community side of things.
Okay.
And when we were thinking of community, one very crucial point that the entire strategy designer for this initiative was Dr. Somesh Kumar, who is our senior director, now works out of US office. But he was I would say the mentor for every team member on this particular thing. And the one important point that we started was that calling this as a breast health initiative. Because when you go and call it as a cancer, we know that it's about private organ. There is a taboo in itself to start with.
Yes.
Then it's about cancer. Then there is fear. And then because the current situation is late detection, or long symptomatic period, we really have to make it in a positive, we really have to create that positive environment around it.
Very well.
The first thing that we did, we called it as breast health initiative.
Wow.
And that started in Lucknow and Ranchi, in the periphery of these two major cities. And again, why started with cities? Because you need to have management institutions,
Yes, that is so important.
Exactly.
No point in just doing the diagnosis and leaving them there.
Exactly.
Yes.
So that was one. So calling it as breast health, right? And even if there is a screening for cancers, if there is a benign breast disease, teams ensured that for those benign breast diseases, there is a management available in the through the
Wonderful.
collaborating institutions.
Wonderful.
Now, when they started, there were 5 pillars in this entire process. And we usually use these 5 pillars even now in any of our programming, related to cancers. The
Okay.
first pillar is around awareness, and
Okay.
this awareness is not only for frontline health workers, because it is very easy to say that they don't know adequately. But I must mention that for cancers, we have to do this awareness at all levels. Because
Right.
if I'm a program manager and I'm not confident, about cancer or managing cancer care, I'll never get into it, right?
Oh,
And that's why that awareness was made for everyone, and we
okay.
call it as demystifying cancer care.
Areva.
And anyone can actually manage it if they know what they need to do at their level.
Wow.
The second one is screening. And now screening is also not only, just like a theoretical coaching. What we tried to do, we imported a few mannequins and actually institutionalized hand holding using those mannequins for breast lesions, So those
Wow.
mannequins have a very good provision of changing the size of the nodule through the backside of those
Oh
mannequins.
my God.
And you can actually palpate those tissue, palpate those
My
lesions
goodness.
using the mannequins. And all of that was done in the public health setup. And our
Fantastic.
ANMs and CHOs were actually using those mannequins to build their competency in the screening.
Wow.
The third one, what to do with everyone who is screen positive, right? So the
Right.
third pillar is about defining workflows. Let's say if I'm in Lucknow, where I can go for my subsequent checkup. If I'm screen positive, I need to undergo imaging, I need to undergo biopsy. Where can I go?
Yes.
If I'm in peripheral district of, let's say, Amethi, where I should go, because we were trying to create those context-specific workflows and we invested into it, and that showed some result. The final one, and here we know our boundaries, final one is management. And for management, we simply collaborated with cancer institutions, because we don't want to get into the space where we really don't know things, but just want to ensure that diagnostics gets completed and then patients are referred rightly to specialists like yourself so that they take subsequent care as required. And with these 4 pillars, which we call as, let's say, vertical pillars, we have to have a horizontal pillar, which is of recording and reporting. Because unless you are measuring all of this right from awareness to management, you will lose on the way, right? And I like to show you one slide, which actually eventually got published also in one of the peer-reviewed global journal, which talks about what happens when you really measure things. Can you see my screen, ma'am?
Yes, we can.
Yeah. So, ma'am, this is the continuum of care, I would say, which starts. And when we started this project back then, it had we tried to cover around 100,000 plus clients. And that, like I said, through our community health workers, which are ASHAs. All ASHAs were provided training to motivate women to come to the facility for clinical breast examination. Because of all known social issues, around 68,000 of them, like 63% of them, came to the clinical breast exam.
Okay.
When they underwent clinical breast exam, around 4% of them turned out to be positive, by the auxiliary nurse midwife on the field level. These women were asked to go to the diagnostic center, and around 39% of them only went to the diagnostic center,
Okay.
And because we were also getting into this entire area for the first time, we realized that simply screening is not at all adequate. Because these diagnostic facilities were at higher center, there is a natural barrier for women to go to that higher center. And I don't have to say what are those barriers. We all are pretty aware about those barriers at social level. But then those who actually reached, 70% of them had something,
Okay.
which shows that health workers, if they screen well, 70% of screen was actually an accurate screen. Subsequently, around 62% of those completed their diagnostic evaluation, and we were able to find around 27 cancers from community to facility based work. Now one way to look at this diagram is, there are so many dropouts, right? One can say that so many dropouts at every juncture. But I must tell you, ma'am, I don't know if there is anywhere else where this sort of a continuum is available, where you have everything from community to diagnostic center to facility for breast cancer. And thankfully, all 27 patients were put on treatment. 21 initiated treatment using the partnerships that we had. And I like to share that 62% of those were in early stages. Now,
Wow.
if I link this to WHO's target, which was 60% early detection, I think this project was somewhere achieving and trying to achieve that.
My goodness.
More important is also the size of the lesions that got diagnosed. Because when we consulted some specialists at the Lucknow-based colleges or institutions, they reported that the average lump size of these clients that they come to their setup or they operate on is around 4 to 5 centimeters.
Right.
Lumps that we observed in these clients were less than 3 centimeters. And that also shows that downsizing and eventually downstaging is possible if you have continuum of care and if you have competent players, competent providers at every juncture in the continuum. Ma'am, this work, we are very happy to share that with Government of Uttar Pradesh's support and other stakeholders, this work got published in Cancer Journal, is considered as one of the path-breaking work in the resource limited setting.
Oh my goodness. Oh my goodness.
Yeah, ma'am, and we were also able to share it in World Cancer Congresses.
Oh my God. I mean, Parag, if you deserve a standing ovation for this. And I cannot stop clapping for this fantastic work that has been done by you and your team. And what a thought, what dedication, and what management, and what execution. I mean, this is the kind of work that really is path breaking and which is going to take India way ahead. And it's youngsters like you who will be the face of new India. And genuinely a big round of applause to you, Parag. We are so proud of you. And this is a project par excellence. And it is mind blowing. It is phenomenal. Thank you so much for doing this for India. And thank you so much for sharing it today on this platform. I'm so blessed to be the breast committee chairperson who's being interviewing you today for this. I mean, I have no words today, Parag. Genuinely, I have no words. And I'm excessively proud of you, genuinely. And if all of us had even a little bit of vision, even 10% of this vision, maybe we can do wonders for our country and for the women of our country. And thank you so much for presenting your work here today, Parag. We are so proud of you. Thank you very much. That downstaging was phenomenal. It was phenomenal because I think we have a landmark paper from Dr. C.S. Ramesh and Dr. Badwe sir from Tata Memorial, which has also stated the same findings that clinical breast examination done by any healthcare worker.
Yes.
I think this is so important. This phrase is so important because we as doctors keep feeling, Arey, I am so busy in my OPD. Where will I do clinical breast examination of each and every person who walks into my OPD, which is actually the norm, which is the required thing. But here this study is telling us that it can be any healthcare worker. You'll have trained ASHA workers in such a beautiful manner, and there has been such a phenomenal rate of diagnosis and a phenomenal downstaging. So the same thing that paper stated that it is going to reduce the mortality by close to 50% in women beyond the age of 50 years. So can I just ask what was the age group of the women of these women that we checked, 1 lakh women?
Ma'am, these were 30 to 65.
30 to 65.
30 to
Yes.
65.
Because in India, breast cancer occurs at a much younger age as opposed to the West. And so I think this was a perfect age group that you took, Parag. And my God, I mean, so much hard work, so much of thought, and so much of efforts that this is really a path-breaking and a prize-winning paper. So congratulations to your team once again, Parag. And well, I think I've forgotten the next question that I want to ask you. I got so extremely impressed by this wonderful paper. And yeah, so one thing that you mentioned just now was that, they had to be taken to the tertiary health centers for the investigations. So what do you think about these mobile mammography vans? Or what is your thought process about mass screening measures, thermography, AI-driven thermography? They are claiming that it can be used for mass screening, because in a country like India where the population is so high, you had a fantastic number, but our population runs into crores. So, for mass screening, can there be something else? Can things like thermography help? Can a mobile mammography van or a unit help, so that we take care to the doorstep of the woman, so that her fear, we saw that there were a few dropouts. So, if we take healthcare to their doorstep, do you think that we'd be able to, reduce these dropouts, have a even earlier diagnosis? Like, what is your thought process?
No, absolutely, ma'am. And I think we are absolutely open to these different solutions, these different innovations.
Right.
Having said that, ma'am, many of these products we really need to ensure that they are validated
Yes.
as per
Yes.
the regulatory norms.
Right.
We ourselves have tried some of them in collaboration with governments. Like you mentioned about mammography, ma'am. We currently are doing a project
Mm-hmm.
with Uttar Pradesh government, with All India Institute of Medical Sciences, to explore the possibility of mammography for screening in Indian settings. Because as we know that we do have lot of mammography machines availability probably, but we do not have adequate number of radiologists or even adequate number of breast imaging experts.
Right.
Can
Well,
AI help there, right? So
yes.
that's one question that we are also right now exploring, and maybe, ma'am, in few years we will have something out of that. With respect to other devices, I also agree with you on the point that CBE might not be doable in every corner the way we expect, because the biggest question around CBE or clinical breast exam is its quality. And when you are relying on auxiliary nurse midwives and CHOs, they might not get adequate time. They might not have adequate setup to ensure
Yes.
that CBE happens in a manner it should happen
Yes.
with the
Yes.
dignity of woman ensured in that setup, right?
Yes.
And that's why these devices do have a promise. And I do believe that, if they are clearing all the regulatory hurdles and requirements, each one of these have space in the Indian setting, in the Indian public health setup, and we should be open and open to explore all of them, and ensure that we support such devices, support their introduction. In fact, ma'am,
Right.
I also want to mention that at JHPIEGO, one thing is there is a tagline of ours, which is
Mhm.
innovating to save lives, right? So, and
Yes.
we consider our duty is to do process innovations, to provide platform to these products, right? So,
Well said.
and that's why with this platform, or with this, Gyan Pravah also, I want to mention, if there are any such products, we will be happy to identify right platforms, happy to support on right process innovations, so that
Wonderful.
these products can get the field and actually get validated in the real world.
Wonderful, wonderful. That is very kind of you, and that is very, proactive and open, because sometimes we do not get such open-minded approaches, like we just have closed doors. Okay, mammography and only mammography for screening, but we have to think out of the box, because there is a huge amount of work that has to be done, and if something can help in that, definitely fantastic. Where does India stand? I think you work with many countries. You work with the sub-Saharan countries. Your wings have spread far and wide. So when it comes to healthcare, when it comes to diagnosis and management of cancers, and even maternal mortality, where do you think India stands on the world map?
Ma'am, I believe we have done really well, but we have a lot to do. If I just again quote real numbers
Yeah.
from Globocan, if 10 women get diagnosed with breast cancer in US, 9 out of 10 survive.
Yes.
6 out of 10 survive in India,
Right.
and 4 out of 10 survive in countries like Uganda. And we know that within India we have many pockets like Uganda, right? So,
Yes.
and
Yes.
even worse than that probably, right?
Yes.
So the main thing is we are right at that middle point, I believe, right? So we
Mhm.
have promised, but we haven't yet reached that 9 by 10 in US, right? So I
Ah.
think if we have leaders like you, leaders in Foxy, leaders like Sunita madam, who really jump into area which probably is not considered as traditionally their area, like you mentioned,
Right.
I do believe we can, do all of this really fast and ensure that we
Wow.
also have survival rates like 9 by 10.
Wow, wow, wow. I think that is so well said. That is really well said. And yes, we are at crossroads currently. I think, we are from a developing nation. We are entering just into the developed nation kind of phase. But yes, there is a lot of work to be done. And I think that, 50 1,000 gynecologists in Foxy, if all of us decide, that together we will take up this process of clinical breast examination and, make it work, I'm sure that, we will do our small bit for society. And that is exactly why we are having the BreastCon 360, which is the conference on breast health, which is coming up across the, around the corner just the next weekend, just to encourage gynecologists to know a little more about breast health. In our own small way, we continue to do our work. That is how I would put it. And I feel that healthcare is improving, healthcare is doing very, very, very well. But what do you think? Like suppose you had unlimited funds, Parag. You had just a big vault, of money with you. What do you think? How would you go ahead? What project would you take up to eliminate cancer, or how do you think you could help our country?
First of all, it's a very it's overwhelming to hear that I'll have a lot of money because because in public health you're always resource constrained in a way. But
Yes.
no, ma'am. But I do believe it's possible if everyone, if not money, at least efforts are get invested.
Okay,
It's
well
very
said.
much doable. But the first thing that I really like to do is to move from this disease-centric approaches to wellness. You know,
Oh,
because if you see, even national government has that vision, right? We have now 150,000 plus health and wellness centers, and
oh,
they,
oh.
they they didn't call it as primary care center. It was health and wellness center or sub center,
Right,
right? So
right.
so I think that is
Beautiful.
also that is also one,
It is one step ahead. Yes, yes.
yes, one step that government has taken at least to break that narrative.
Wow.
So this wellness focus will really be of crucial importance, because that will naturally bring attention to pollution, attention to better diet, attention to, monitoring your own self health, because it's all
Wow.
about your vitals, it's all about your own examination, right? For
Wow.
breast, we are talking today. Self breast examination, the culture of having self breast examination on a monthly
Yes.
basis itself can help us to reduce that symptomatic period considerably. Even for cervical cancer, you have now self sample collection,
Yes.
and with these digital gadgets, tools, mobiles, we all know that it is easier nowadays to give those nudges to
Mhm.
monitor our own health.
Wow.
So if I get that sort of a money, I believe I like to really run this sort of a
Oh my God.
wellness focused campaign all across public and private sector.
I
Uh,
think I think Dr. Tandulwadkar was 100% right when she said that, over the course of this podcast, I'm going to get to understand Parag much more and much better. And that is indeed so true. I mean, what a beautiful vision, to talk about wellness when you're talking about illness. I mean, I really appreciate this thought of yours, Parag. And I think each one of us has to, look into ourselves and see what we can do for our own wellness. It is our body, it is our health. As a human being, it is my duty to look after this beautiful temple of mine and make sure that I stay fit and healthy. I think that is a wonderful thought that you've put across, Parag, and I really appreciate you for it. And I hope that all our viewers and people who are watching this podcast will appreciate this thought and take it upon themselves to look after their own mind and body. I really love that thought, Parag. So I think, Parag, one very important thing that I kept thinking of before I started this podcast was that you are out of the box. You have, chosen a path less traveled. And what do you think are the qualities, which are required by any doctor, any human being, any person to be able to, work in these kind of NGOs, in these kind of government sectors, or so selflessly to, just throw yourself into the arena of women's health or any kind of social work, because I think, I don't know, it does it need to run in your blood, or whether you can cultivate it. What is your thought process?
I don't know, ma'am. Very again, a very very difficult question, in fact. But um, I think I think it's just that if you find that purpose, if it's just that sometimes people find purpose in getting more money. Uh, so if you can find purpose in such sort of a social work, or not social work, I would say, it's not like we are underpaid. We are also adequately paid, but it's just that you find that cause, you find that purpose, and then get right sort of a mentors
Yes.
who encourage you all along the way. Because one very important thing, ma'am, and I will really like to put here in front of everyone, that this is not an easy field that way, right? Like
Not at all.
because you don't see returns immediately, right? When you're a
Right.
clinician, you know that I have given a treatment, and in 3 days, 5 days, 7 days, or 15 days, I'll see something in return, right? If
Right.
you're a surgeon, you know that you have removed the lesion, right? But it
Right.
doesn't happen in public health that way. So you need lot of motivation, and I think energy from leaders who are around us and mentors who are guiding us on the way is very, very crucial. And yeah, that's it. I think I don't have much to say on this one. Yeah.
I think it requires a lot of dedication, a lot of, single-minded, focused approach. And that, because as you rightly said, the shortcomings must be so much because sometimes the funds come, sometimes the funds don't come. You just have to wait for it. Or sometimes your ASHA workers turn up, they don't turn up, the patients come, don't come. You examine so many of them. So many of them need to reach the diagnostic center and they don't come. It can be so disheartening. It can really put your morale down. But I think your strong-willedness, wherein which no, you have to keep doing it, keep pushing, keep motivating, and that's constant, as you said, nudge, which you have to give yourself also very very often. That perseverance and maybe that focused approach is probably what has helped you to reach where you have reached, Parag. So once again, we're really very proud of you and the kind of work you're doing. And I'm sure that if anybody after hearing this podcast wishes to, I don't know whether they can really approach you, join your organization, or how they can associate it with you. Because again, you are a powerhouse yourself. So you may be attracting so much of positive energy, and people might be wanting to work with you. So I'm sure that you will be more than
Yes,
willing and happy to have so many people joining you and getting a little know-how. So maybe we could just start off some small projects for our Foxians. We could just design some simple charts or some simple flow, what do you say, proformas as to what questions to be asked to women to ensure about her breast health, or maybe you could just help us design something small like this, and we can make that small change for our patients. So let us see how best we can take this forward. So now, Parag, I really want to know about what new you're doing, what different thoughts are running in your mind, what is the new tsunami that is going to be coming into India through Dr. Parag Bhamre. Any new projects around the corner?
yeah. So, ma'am, on this, no, I want to go back to what Dr. Sunita also mentioned, the Nirmal Banaras Abhiyan, which
Yes.
is started with Foxy, with Madam's leadership. It got launched in the month of March at UPCon. And I
Yes.
think, ma'am, that is something that's probably is going to be a crucial one, because agenda there is to really achieve or demonstrate that, how do we move towards cervical cancer elimination, and how
Right.
do we move towards achieving this 60-60-80 goals for breast cancer. So in Varanasi, I must mention, and like you said, ma'am, there is a readiness amongst OBGYNs. If there is readiness, what is the formula? I think that formula is getting ready in Varanasi and Lucknow right now,
Oh, wonderful.
wherein there are 20 to 25 gynecologists who have already established these cancer care clinics in their established setups,
Oh,
and those necessary templates, posters are almost, ready and displayed in their setups. So I think that formula is emerging from Varanasi with
fantastic.
Fox's leadership, and that Nirmal Banaras can actually become then Nirmal Bharat eventually. So
Yes,
let's see how it
yes.
goes.
In the true
Uh,
sense.
but
Yes.
there are, and with this government of India's vision on bringing HPV vaccination, I think again we have a very good opportunity to strengthen women's cancer space. But I also want to mention, ma'am, that vaccination right now is for adolescent girls. We
Yes.
have to, add voice to the importance of giving attention to screening, because women who have missed the vaccination opportunity
Right.
should not be, left out. We should continue to offer screening programs, and that's why Varanasi model probably will be a better one, where you have vaccination plus screening plus treatment. You
Wow.
know,
Yes.
So that's something that I'm really excited with, and I think with leaders like you, I think that's just a matter of time.
Wow, 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 wow. I think, really the river of knowledge is really flowing so beautifully. And I think whole of India is awakening, and we have, powerful voices and motivators who are taking all these projects ahead. And I'm sure, soon we will be, I cannot say cancer free, but yes, I mean, something very close to that, because nothing is completely, cannot be really eliminated, but early diagnosis and giving the woman the quality of life that she deserves, even after getting these kind of diseases, is what is so very important. So,
Ma'am,
Parag, let us,
sorry,
sorry.
sorry. Just one thing, ma'am. In cancers, no, like we used to see in movies, right? Cancer matlab done, right? That's
Ah,
not the reality. If you detect early, like for breast cancer, if detection happens in stage one, survival is 95%. If detection happen at stage two, survival is 92%. The
so true.
real magic is early detection,
Absolutely
and
well
with
said.
these so many environmental tracers, cancers is to a point that it is inevitable in few cases, right?
So true.
But you
So true.
just have to avoid it. You just have to detect it early.
Very
And
right.
what we call it is stage shifting. How all of us can actually ensure that stage shifting is something that needs attention, because there are so many wonderful specialists and treatment sites that are available. If you go in time,
Mhm.
you are saved. That's how the entire narrative is. Yeah.
Right. A stitch in time definitely saves nine. And I think that what JHPIEGO, Dr. Parag Bhamre's team is doing is really mind-blowing. The fantastic work they have done to talk about clinical breast examination and how it can downstage breast cancer is a very big eye-opener. And I think that all of us gynecologists, as well as all the healthcare workers, should come together and realize the importance of these beautiful fingers that we have, 10 of them. Use the middle portion or the pulp of our fingers for clinical breast examination for each and every woman who steps into our OPD, is going to go a long way in the early diagnosis of breast cancer. Early diagnosis saves lives. And that is what Parag has been doing. And let us all join hands in this movement. And let me tell you, we are launching something called as Mission Pink Palms at our upcoming BreastCon. It's a work of amongst the all Maharashtra OPG1 societies, wherein we are going to talk about self breast examination and clinical breast examination. And in a country like India, where even talking about breast is taboo, leave alone touching the breast, we want to encourage our women to become breast aware. We want to encourage all our gynecologists or our healthcare workers to do the clinical breast examination and give our women a happy, healthy life, even if they have breast cancer. So, Parag, thank you so much for coming on this Gyan Pravah podcast, which has been started by Dr. Tandulwadkar. And your inputs have been really mind blowing. The hard work that has been put into this paper is really amazing. And I wish you all the best for all your future endeavors. We would definitely like to stay connected with you and work with you at any possible juncture. Thank you.
Thank you so much, ma'am. Thank you so much.
Thank you,
Thanks a
Parag.
lot.